My name is Dr. Devon Tobey. I'm an orthopedic surgeon with Piedmont Orthopedics, OrthoAtlanta. I subspecialize in musculoskeletal oncology and joint replacement surgery. During med school, I found myself pretty early on gravitating towards a surgical subspecialty. I really enjoyed kind of the hands-on approach to surgical fields and kind of the instant gratification and problem solution that you see in a surgical setting. And I really enjoyed the aspect of orthopedic care where I was able to have a patient that comes in with pain or something that interferes with their quality of life and really be able to offer them some treatment options to get them better and able to enjoy their life better. My true love and passion within the orthopedic field is musculoskeletal oncology. That is a fancy way of saying cancer and how it affects the musculoskeletal system, how it affects the bones and the soft tissues. And then on top of that, throughout my training, I did get a lot of exposure to joint replacements, particularly complex joint reconstruction surgery. The OrthoAtlanta Piedmont Orthopedics partnership kind of fit my career desires perfectly. Every week we have a weekly tumor board conference where it's multiple subspecialties, orthopedics, general surgery and surgery oncology, radiology, medical oncologists, the genetics team. All of those people are involved in taking care of a patient and making sure they get the right treatment, the right follow-ups, and the Piedmont Healthcare system has been crucial in that aspect of my practice in order to build it. And that's why I chose this as my job, because it fit everything I wanted. I'm taking care of my community, and I'm able to take care of complex patients in a good healthcare system that it provides the support it needs for my patients. You know, these patients come to us and they're trusting us with their care. And the compassion aspect, I think, this is sometimes, a really hard decision, a really hard discussion with the patient. Even if it is just run-of-the-mill arthritis, being compassionate and supportive of how we deal with that, how we move forward and manage this and try to get them better and back to their activity is really important for creating relationships with patients and trying to get them better. In regards to surgical proficiency and technical proficiency, that obviously comes into play when I'm operating on patients. I've had a lot of experience and a lot of training. I feel confident in my skills to be able to take care of my patients, both my complex cancer surgeries as well as the complex, joint reconstruction surgeries. I think the difference that I have in my practice is that I do treat pediatric patients, particularly in the cancer field, anywhere from young patients all the way to very elderly adults. Taking care of kids is really exciting for me, even in the general orthopedic care for patients. It's very much rewarding to be able to be a part of that journey in a patient's life. I really think compassion and honesty and open communication with your patients is really important to be able to make those medical decisions and figure out what's best for their next step of care. I love what I do. I really enjoy being able to help and provide care to my patients. So there's ups and downs during treatments, but the patients that do well and I get to have a positive impact for, it is really exciting to be a part of that. It's why I went into medicine and why I chose what I do. And I really enjoy that part of my practice.